First aid. So this lecture will be on first aid. I'm Dr. Samanna Nayakkara, Senior Lecturer in Anesthesiology and Critical Care of University of Peradeniya. So as a medical person, you will be doing and getting engaged in different medical procedures, and you will be taking part in different medical resuscitations of acutely ill patients inside the hospital. However, if you encounter a medical emergency outside the hospital, you should know first aid to tackle that situation. So, what is first aid? First aid is an immediate assistance. First and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life and prevent the condition from worsening or to promote recovery. So it will include the initial intervention in a serious condition prior to professional medical help being available, and such as performing cardiopulmonary resuscitation or just stopping bleeding or just attending to a wound or a fracture or a dislocation of a joint or any other medical condition like a seizure or an unconscious patient. Sometimes, if the condition is a minor condition, first aid is enough as the total treatment also. So, what is the importance of learning first aid? So, firstly, to recognize rapidly the occasion that needs first aid. So, you have to have some training. You have to have heard about these things. Then, sooner you come across a situation like that, you will realize, all right, so I need to get involved and do some first aid. Secondly, learning first aid will be very helpful for you to commence first aid very fast and execute it in a very effective manner. Then also it will be useful for you to assist in administering first aid when a co-worker is injured. Okay, now let's see what you need to do in a situation where you have to provide first aid. So first you have to quickly evaluate the situation, see around and see what the situation is. Then approach the victim when it is safe and in a safe manner, right? So as the resuscitator or as the person who is going to conduct first aid, you should not jump into the situation, and you also should get affected with whatever the trauma or injury that has happened. For instance, there could be a fume, there could be a smoke, there could be a fire, there could be a wild animal attack or contact of the victim with a live wire. So in a situation like that, look around, see whether it is safe to approach. If so, approach. Then you need to assess the patient quickly, going through A, B, C, D, E in that order: airway, breathing, circulation, disability, exposure. Because the areas that you have to attend, airway, breathing, circulation, disability, and exposure, they have been arranged in that sequence because of the importance of each item above the others. For instance, airway should receive the first priority. If airway is threatened, there's no point in trying to establish breathing. With an obstructed airway, for an example, you can't establish breathing. If airway and breathing are jeopardized, there's no point in trying to establish circulation. So you have to stabilize airway first, support breathing next, then only you should think of circulation. So, like that, you have to prioritize care. If the victim is going to die of a particular reason, you should try to attend to that first. Then see whether the patient or the victim is wearing any medical tags or braces or showing any medical alerts, which will say, for an example, people who have allergies to various things might be wearing a bracelet saying that he has an allergy to a particular food, right? So, if, for an example, if this patient you are suspecting to be in an anaphylactic shock due to consumption of that whatever the food that he is allergic to, then you need to quickly activate your management with a plan that the patient has an anaphylactic reaction. So you need to have a quickly head to toe check in addition to the primary problem that you have detected, because there can be a secondary problem. There can be another injury, secondary injury, due to which the patient or the victim could die. Well, you need to call for help. In a situation like this, any medical emergency, it's always better to get help from others. So if there are people around, you can shout and call them, get them down to you. If there's nobody, you can ring them. You can call for medical help, call for an ambulance. So in Sri Lankan setup, you can call for 1990 and then mention what exactly the problem is, and then an ambulance would reach you. Okay, so first let's look at an unconscious patient. How are we going to start first aid for an unconscious patient? So unconscious patients, so patients who are not responding, who are not responsive, can be discussed under two, axes. One is a not patient who is not responding or unconscious, and who has no breathing, who is not breathing. The other patient is a patient who is unconscious or not responding, but who is breathing. So when you look at the first patient who is unconscious and not responding and not breathing, so for all practical purposes, you have to consider this situation as a cardiac arrest. So you will remember in the lecture on advanced life support also we told, for all practical purposes, if a person is unconscious and not breathing, in short, no responsiveness, no breathing is equivalent to a cardiac arrest. However, we being medical people, we can also check for pulse while checking for breathing. So we can, all what we have to do is to keep our fingers on the neck to check for carotid pulse. And so if this patient has no conscious, not conscious, not breathing, and no pulse, this is a cardiac arrest. We have to immediately start basic life support, and if we are inside the hospital, we can start advanced life support. So you have to start CPR, cardiopulmonary resuscitation, with chest compressions. On the other hand, we could have a patient who is unconscious or not responding, but who is breathing. So if somebody is breathing, generally there can't be a cardiac arrest. So you have to turn the patient to a side, to the recovery position or semi-prone position. Open the patient's airway, let secretions drool out, and continue patient's monitoring of pulse and respiration. So this patient may be unconscious and breathing for the moment, but the patient may stop breathing at any time. So it's very important that you continue monitoring of pulse and respiration. Right, so earlier we discussed, if a person is not responding and not breathing, for all practical purposes, it's a cardiac arrest. Patient may have pulse or patient may not have pulse. Even if the patient has pulse, if the patient has stopped breathing, then the pulse is also going to stop within the next few seconds. Now, the other group of patients who are not responding but breathing, who are not responding, not conscious, but they are breathing, right? So they can have different causes. So it generally, the commonest cause for being unconscious like that with breathing is the victim having a fainting attack or vasovagal attack or syncope. Or patient could be hypoglycemic, or the patient may have had a transient ischemic attack or a stroke, or it could be a seizure, anaphylaxis, could be an acute coronary syndrome, could be due to an electrolyte imbalance or drug overdose. So here there's no cardiac arrest, but the patient is unconscious. However, there's breathing. So you have to try to figure out what the possible cause could be for this unresponsiveness but breathing, and try to fix the problem. let's see what sort of first aid should we. Right. So, in a patient who is not responding or not conscious and not breathing, what are we going to do? So, I told this is for all practical purposes, it's a cardiac arrest. So, you have to start CPR, cardiopulmonary resuscitation. So, lay the person on his back, call for help, call for 1990, and start chest compressions. Right. So, I hope you can remember our lecture on advanced life support where I talked about placing uh, both hands of you interlock each other and placing in the middle of the lower half of the sternum and compressing uh, 4 to 5 4 to 5 centimeters in the anteroposterior diameter at a rate of 120 per minute. So those are what we call chest compressions. Do a head tilt and chin lift for opening the airway. And since COVID-19 concerns are there, it's always safer to cover the face of the victim so that uh, you minimize exposing your head or your face to the victim's respiratory secretions. So, no mouth to mouth breathing is discussed as an option, especially in an unknown person. So, continue chest compressions until help arrives. Okay, what are we going to do in a patient who is bleeding, who has hemorrhage? So that could be from a major vein, major artery, or an intermediate size artery or vein, or could be a small vein or small artery. And so try to wear gloves. So all of us have concerns regarding spreading of various infections now. So it's better to wear gloves if you have access for gloves. Then try to stop bleeding. So whether it is one of the first things that you should try to do in a person who is bleeding. So either apply pressure or elevate the part where there is bleeding compared to rest of the body in relation to the rest of the body. For instance, if the patient has a bleeding from the head and neck area, prop up the patient 45 degrees. So then uh, arterial pressure there is less, therefore bleeding is also less. So applying pressure, elevate, keeping an ice pack. Try to see whether you can apply a tourniquet. A tourniquet will stop further arterial perfusion to the area, but you can do it only if you have an injury in a periphery of a limb. And try to put a tight dressing with the hope of minimizing bleeding, and that will encourage a blood clot being formed, and thereafter there will be hemostasis. So it's always good to clean a wound where there's bleeding with antiseptics and dress the wound. And suturing the wound, if you have the facility, at the same time would be of immense benefit for the patient, and start the patient on empirical antibiotics. And now we will move to the next slide where we have to discuss things about shock. So earlier we discussed under shock that shock could be due to multiple reasons. So it could be hypovolemic shock, distributive shock, cardiogenic shock, or obstructive shock. So whatever it is, you have to lay the victim on a side, supine, and try to cover the body. Patient may already be having vasoconstriction or vasodilation depending on the type of shock. However, it's beneficial for you to cover the patient and try to raise the feet. Thereby, you are trying to force blood that is stagnant in the stagnant circulation to enter the main circulation. Right. Now let's say you have a patient or a victim who has an anaphylactic shock. So what sort of thing should you be doing there? So if possible, try to stop the exposure to the causative agent if the patient is still being exposed. Let's say now there are situations, there are things like patients have been bitten by wasps, So the the small sting sort of thing left behind on the person's body has to be removed immediately. Or if it is a chemical or other drug that has caused the anaphylactic shock, stop using it. Call for help. Obviously, this like any other medical emergency, it will be very difficult to manage on your own. Try to call for help. So put the patient down supine on the patient's back. If the blood pressure is low, if you feel the pulse volume is also low, you might not be able to measure the blood pressure in certain situations. So put the patients in a head low position if possible. And if the patient is unconscious and no breathing and no pulse, this is a cardiac arrest. Well, you have to start CPR, cardiopulmonary resuscitation. And if the patient is unconscious and has breathing and there is pulse, this is not a cardiac arrest. And you have to turn the patient to a side, keep the patient on semi recumbent or recovery position. And now, adrenaline is the drug of choice in anaphylaxis, but if this has happened outside the hospital, sometimes it will be very difficult to find adrenaline. But patients with a known history of anaphylaxis may be carrying an adrenaline injection with them, subcutaneous adrenaline, and there's a say branded things like EpiPen. The patient may be having it in the pocket or handbag, pull it out and deliver it subcutaneously. When the if the patient is awake, you can always give an oral tablet of chlorpheniramine 4 milligrams and an oral prednisolone maybe 30 milligrams to be taken if you have access to medicines from at least from a nearby pharmacy or whatever, till the patient is taken to the hospital and proper medication is started. Right, let's say this time you have a patient with a possible heart attack. So the patient may be complaining of severe chest pain, may be associated with nausea or vomiting and sweating, which is very suggestive of a heart attack, acute coronary syndrome. And so, what are the things that you can do? So, you have to call for help, obviously, 1990, and make the victim comfortable, loosen tight clothing, check for history and medications. There may be somebody from the family, and you can see whether the patient has whether there's a past history of ischemic heart disease, past myocardial infarctions, and things like that. The smoker, these may be suggestive. Hypercholesterolemia, these may be things that are suggestive, suggesting that this is possibly a heart attack. And keep the victim still. Don't move the patient. Don't get the patient to walk or stand or anything like that. You should keep the patient comfortable and help the patient, take the patient to an ambulance or another vehicle to be taken to the hospital. Meanwhile, as first aid medications, it would be always better if you can give the patient aspirin 300 milligrams, clopidogrel 300 milligrams, and an atorvastatin 40 milligrams. And don't use stimulants like salbutamol. They will using them will be counterproductive with a situation like acute coronary syndrome. Right. So choking is another thing that you can come across at any time. It may be with a child or an infant or even an adult at times. So choking is a situation where you have a foreign body aspirated stuck in the airway, which could be the upper airway, middle or lower airway, causing airway obstruction, generally leading to a hypoxia and can cause even sudden death. So in a situation like this, there will be a history of a patient who is okay up to this point and has a sudden onset of difficulty in breathing or shortness of breath. And if you see the patient, you will see a patient struggling to breathe, fighting for life, very anxious, sweaty, trying hard to breathe, and he may be holding onto the neck of the patient himself or herself, may be trying to breathe hard with holding onto the patient's neck. And if you try to talk to the patient, he will find it difficult to talk. And if you can get the patient to cough, sometimes it might bring the foreign body out, but it will be difficult at times. So one of the first things you can try is to try some back blows. So you go around the patient, bend the patient forwards a little, and deliver some blows. on the back, and with the force being applied towards the head and neck area, trying to force the foreign body to come out. And if that doesn't work, you can try the Hemlich maneuver, where you will again put your hands around the patient, wrapping the patient around, and again bending the patient forwards a little and applying some uh, blows, thrusts onto the upper abdomen, trying to force the foreign body out. And if it doesn't work well, you can try back blows again and abdominal thrusts again. Right. So if abdominal thrusts don't work, so you still will have to continue your first aid. Call 1990, call for help, and see whether there's a foreign body obvious on the mouth. So you should avoid the blind finger sweep, but if there's an obvious foreign body in the mouth, you can put your finger and try to take it out. And I'm reiterating the fact that you should be wearing PPE, personal protective gear. We have COVID concerns all the time in our mind. Continue abdominal thrusts, and if there's no breathing and no pulse, start CPR. Right. So another thing that can happen is you can encounter a person who has been subjected to an electric shock. So one of the first thing, or the first thing you should do is to switch off the power source, which is in contact with the person who has had the electric shock now. If it is not possible to do that, at least try to move the source away from the person using a dry, non-conducting object made of cardboard or plastic or wood or something. And if the patient is unconscious and no breathing, no pulse, it's a cardiac arrest, and start CPR. And if the patient is unconscious but having pulse and respiration, the patient is not having a cardiac arrest, so turn the patient to a side semi-recumbent position and continue monitoring, and call for help. So a person who has had an electric shock can have other associated injuries. Now sometimes after having an electric shock, people get thrown off, sometimes to quite far away distances, and as a result of that, they may sustain fractures, dislocations of joints, lacerations, bleeding, wounds, and burns. So you have to attend to those wounds or fractures and dislocations in addition to the resuscitation. So after sorting out the initial cardiopulmonary resuscitation, if the patient is alive now, so now is the time to attend to those things. Right, so eye injuries are very common. You can come across eye injuries during any outside occasion when children play, and or even as a domestic accident. So if there's a chemical splashing into the eye, we should keep the eye open and wash the eye immediately with water at least for 15 minutes. So we can wash the eye under a tap or pour clean water into the eye. Well, if there's contact lens, wash over the lens, then the lens will get washed away. And after that, we should not bandage the eye, we should not cover the eye, leave it open. We can also come across penetrating eye injuries. So it can happen when a sharp object like a pencil or a pen or any other object thrown off at a high velocity go on penetrating the eye. And generally there's protrusion of eye contents, and it's a very high risk situation. Patients can go blind with this sort of injuries, so you need to act immediately. So protect the eye from further damage by using an eye shield or eye cover. If you don't have any of those things, like, try to cover the eye with a piece of clean gauze, or at least a piece of paper. And patient has to be taken immediately to a tertiary care center where there are eye specialists and an eye operating theater, and administer systemic analgesics like 2 tablets of paracetamol with a sip of water keeping in your mind the patient will have to undergo general anesthesia soon after reaching the destination. So you have to keep the patient fasting, but it's quite okay to have a two tablets of paracetamol and a broad spectrum oral antibiotic orally. And if the patient has nausea and vomiting, try to administer an antiemetic also. You can use either an oral antiemetic or rectal antiemetic. And Well, patient might need the tetanus prophylaxis if the patient has had no tetanus vaccination in the recent past. So do not wash the eye this time. So if you have a penetrating eye injury, if you wash with water, then that water, which is not very clean, also it's not sterile water. When we use water, we do not have the facility to use sterile water when we are doing a first aid. So don't wash with water. That water can get into the inside of the eye and cause further infection. And do not try to remove foreign bodies also. Those things have to happen in a tertiary care hospital under microscope in the operating theater. Burns, yeah, we may have to start resuscitating a person with burns. Now, there are different kinds of burns. So, there are burns with flames, burns due to scalds, or burns can happen due to hot surfaces. And so, there are different types of burns. So, if there's a burn with a flame, especially, you have to try to put out that fire first, or stop the person's contact with the fire, or with the hot liquid or steam or hot surface or whatever. And so if the patient is having still a flame on the body where the clothes have caught fire, try to help the person to lie down, stop, drop down and roll to smother flames, and then remove the smoldering material from the person. And so remove hot or burnt clothing, and if clothing is stuck to the skin, don't try to pull it force, then it will pull the skin also. So you can cut or tear around the burnt clothes. And if there are constricting things, clothes or jewelry or belts, remove those things, because the body can swell very soon due to the burn. And if then constricting things are remaining on the body, that can cause further problems, secondary problems, like reducing perfusion to distal parts of the body. uh, you can have milder burns, like what is shown here in the photographs. So still the damage or the injury caused by even mild looking burns can be very severe. So consequences can be very severe. So therefore, start washing with lukewarm water or cool water immediately, at least for 15 to 20 minutes. Would be better if it is running water. So do not use ice or icy water, or very cold water. That can cause further injuries to the skin and the subcutaneous tissues. So after washing, cover the area with a sterile, non-adhesive bandage or clean cloth, and the patient has to be taken for medical care. So do not apply butter or oil or lotions or other creams, especially creams and lotions that can contain fragrance. So it's okay to apply a petroleum-based ointment 2 to 3 times per day, and the patient has to be given analgesics and, if necessary, antibiotics. Okay, patients, there can be victims who have been exposed to very hazardous material. So they could be in the form of a fog or fume or gas or a liquid sprayed or sprinkled or onto their body or clothes or wherever, and it can cause damage to eyes, skin, and or the patient may have inhaled those things if it was a gas or smoke, and or a person may have ingested those hazardous material. And in a situation like that, you have to act quickly and remove those stuff uh, from the patient's contact. If those are still on the patient's face, they have to be washed off. If those are on the patient's clothes, you have to remove those clothes and clean the skin. Then fractures of bones, long bones or vertebrae or skull bones are things that can happen very commonly as a result of sports or during other playing activity among children, or people can fall from heights, from trees or ladders, and fractures and dislocations can happen. So, in a situation like that, you need to immobilize the fracture immediately. So, trying to immobilize with whatever material you have is what is prudent in a first aid management. So, try to immobilize the fracture with by trying to immobilize the two joints adjacently, immediate and distal to the fractured area. So you may use whatever the material that is nearby. So it could be uh, hardboard, a wooden plank, or an umbrella, or whatever you can find. Same thing. Uh, well, you might be able to immobilize it with whatever the splint that you can, and try to wrap it with a bandage or long clothes or whatever. Okay, so we have come to the last slide of the lecture. What shall we do in case of a heat exhaustion? So this could happen to a person who is working outdoors, sportsman, laborer, worker, or children playing outside, especially under hot and humid conditions. So first thing would be to move the person affected to a cool place, lay the victim down, elevate feet, loosen clothing, give some fluids. The the person generally is awake enough to drink fluids, so you can give some fluids for the person to drink. Apply